Hi, I'm Jim McCann, founder of 1-800-Flowers. We created this podcast to share the wonderful people we get to interact with, we get to meet, we get to know, and most importantly, get to learn from. So I invite you to join us on this journey here on the Celebrations Chatter podcast. Well, what a treat we have today. I have an old friend and a new acquaintance at the same time. Let me introduce you to Katherine Oliver. Katherine is a friend and a dynamo and an expert at so many things. Career in broadcasting and the media and journalism, then in government, then in business development, and now using all of those skills at Bloomberg Philanthropies to help cities and institutions around the world be better, do better, and impact more people in a quicker and more efficient way. And Dr. Amy Acton, she's a physician, but she's made the crossover, as Katherine did in so many fields, into the world of public health. And together, these two dynamic people have partnered up to create a series that Bloomberg produced with them on the impact of public health and its state today, its impact in the past, what it should be in the future, and they're shining a light on what needs to happen there to make it the effective set of institutions that it's been, that have kept us safe and changed our life expectancy as a species, at least here in this country, but around the world, so dramatically over the last 100 years. So with that, Katherine, how did you and Dr. Amy connect?
Well, thank you so much for having us. And this is a really important project at an important time. The Invisible Shield is a documentary series that we created and have distributed on PBS. And it was during the pandemic. It's hard to believe, going back, what is it? It's over 4 years now. It was the spring of 2020. We were in lockdown mode, and I was working at Bloomberg Philanthropies from home. And every week we had briefings from physicians from Johns Hopkins University. And we were on a Zoom call. And Dr. Josh Sharfstein, who is a vice dean for public health and community engagement at Hopkins, posed this question. Public health saved your life today, and you didn't know it. And the light bulb went off in my head. And, here we all are, sheltering in place, not knowing what was going on. There was very little information, a lot of conflicting information. And I thought, public health, nobody really understands what public health is. And you think about it, you wake up in the morning, you turn the water on to brush your teeth. That's public health, clean water. You go to the window, there's a child guard. That's public health. You get in your car, you put on a seatbelt. That's public health. You go to your place of business or go to school and there's a no smoking sign there. That's public health. And, there's this invisible shield. When it's there and it's working, you don't see it. And it's there to protect us. But when we are hit with a public health emergency like a pandemic or an outbreak, we then realize just how important it is. And when we needed the system to help us the most with a global pandemic, the system broke down for a lot of reasons. And, Dr. Amy Acton, running a public health department in the state of Iowa, can speak to this and experienced it firsthand. And I thought the greatest thing we could do is to shed the light, to educate people about what is going on and the importance of public health and the importance of these first responders and folks on the front lines, what they do, usually invisible, but they became oh so visible during the pandemic. And we realized that we needed to make change. So we decided to do this series to educate people, to inform, and hopefully to enlighten. And along the way, we put together a group of experts, Amy Acton included, to help us tell this story.
Well, you lay it out so clearly there. I would guess, Dr. Amy, having been involved at the state and local level, that I'd ask you to shine a little light on when Katherine talks about public health. I guess most of us would think about the CDC, especially in the post-pandemic era. But public health, that invisible shield, as you so appropriately call it, is at so many different levels. Can you give us an insight into how public health manifests itself at different levels of government and its interactions with the communities it serves?
Yes, thank you again for having me. Yes, I was the director of health for the state of Ohio. 11.7 million patients is how I like to think of it. Basically, you're sort of the Surgeon General for your state. And I also was the representative to the whole Midwest. That put me in the White House the last week of February of 2020, just as, if you remember, Jim, the stock market crashed for the second time. We've been watching this virus creep around the country, but we were right on that verge. And I remember saying to Mick Mulvaney, who was the president's chief of staff at the time, please tell the president that this is sort of the better angels moment. This is the moment that's like FDR or Winston Churchill. Because if you think about it, we were going to war, except the war was against an invisible enemy. But we all shared the same enemy across the whole world. We actually invented the playbook. It happened, George W. Bush, right after 9/11, recognized that the gravest security risk facing our country was actually either a biologic weapon or a naturally occurring pandemic. Because as we know, it undoes everything, completely undoes the supply chain. We were in Hunger Games for masks. Our hospitals were outbidding hospitals. We didn't have amoxicillin in this country. In this country, we couldn't actually make a 3M mask because the inner layer, the machinery to do that, was no longer here. It's a security risk because bad actors take advantage of it when people are unmoored. And so this was this big moment in our lives that we had all been preparing for. But what people don't realize is that when my grandfather was born in 1900, he was expected to live to 48 on average. 48. Thoreau wrote his great works, Walden Pond. He was done by 48. You know, that was the average life expectancy. Now we know it's 30 years longer. In 1 century, all of life had been this way. When you had children in 1900, a third of your children would die from an infectious disease, most likely. So we gained all this life, but only 5 of those years was due to everything I learned in med school, all the high-tech things we learn that we all want when we need them. 25 years came from things that we can only solve collectively. Like Katherine was saying, clean water, safe food, child labor laws, traffic safety laws. The list goes on and on. But what I told our legislature is when I knock it out of the park and when we do everything right in our field, you don't see it because we prevented it. So you don't see it, therefore you don't fund it. And similarly, when we predicted in Ohio we'd be seeing 10 to 12,000 cases a day, when we flattened the curve by actions we took collectively, people couldn't see that and therefore didn't believe it was happening. So this is the field we are in.
Let me ask you both. It seems a concern I have is very much along those lines, Dr. Amy. That is, we saw a big DEI pushback in the last 12 months, I think. And we're seeing a little bit of a climate pushback, like, well, it's too overwhelming. We can't do anything about it. But during your 12 years in office in the New York City, your administration, Katherine, achieved a lot of good things in the public health sector that, like Dr. Amy pointed out, that don't get properly recognized. Dr. Amy, when you think about the impact of your good works being something not happening, how do you, as a advocate, work to get funding for things that don't have that big headline or the big report that says what it achieved? How do you effectively advocate?
I used to joke that I was the Ted Lasso of politics. My whole life has been, I became a regular physician. I thought I would do pediatrics. I was in the Bronx and it was 1990 and it was the crack cocaine epidemic. And half of the kids in my practice were going to be dead by the age of 3 from contracting AIDS in utero. So this is in our country. And I'd had a rough childhood myself. So by that point, I kept feeling like everything I saw as a doctor was too late in the process. And what I learned through public health, and I also did a bit of philanthropy as well, is solving our wicked hard problems we face, whether it's the opiate epidemic or a housing crisis that we're having. Some of the trickiest problems can only be solved collectively. There's always individual actions, but what we really have to do is get all sectors to row together toward a common goal. And that's the complexity of the world we live in. That said, a lot of the task of this is helping, and I think part of the task of healing right now from the pandemic, and we're witnessing this in our society, is we've been pulled apart. We've been unmoored. And the task, I think, of public health or any leadership, I mean, Jim, I'm thinking about your business as well. I read a bit about you, is this vision that you're setting by bringing all the right people around the table. It always starts with who's at the table, who's missing, and that we literally bring an interdisciplinary group to row toward that common goal. And in COVID, people talk a lot about the hate. You know, you probably heard about Gretchen Whitmer, the governor, having a plot against her life. That same plot was against myself and my governor, Mike DeWine. And it was a militia group in Ohio.
They're all from Ohio. Come on.
No, not all. Ohio is the United States of Ohio. We have all of the same things for the whole country. And a test market because we're so representative, as you know, Procter and Gamble and Cheryl's Cookies and your company. But the thing is, we literally did flatten the curve in Ohio. Like there was this spirit. It was like that 9/11 moment again, where everything fell away. And I think it's so important because that's when leaders almost need to have a narrative and a story that helps bind us. That's why I said the FDR Winston Churchill comment. Because when you face things that are this daunting, your task is to hold space and bring those folks around the table and help us all see the common humanity in one another. And it's not an accident that our Surgeon General has put out an advisory, not unlike the tobacco advisory of C. Everett Koop, but on social connection and loneliness. Because even before the pandemic, we were suffering, and that life expectancy I talked about was going in the reverse direction for the first time in 100 years. And it is because of this, we need this social cohesion. We are literally hardwired to be connected to one another in community. We do not live in ideologies. We live in families and relationships, all of which were being torn apart during the pandemic. And we live in community and we live in neighborhoods. And public health's job is to bring us back to that community. Like I said, the community is my patient in public health, and remind us of all the things that we hold dear, that are in common, and that can only actually be solved by all of us together.
Rowing together is a theme that Dr. Amy talked about, Katherine, and you are the poster child for that, in the sense that in your career, you've always been trying to harness media, government, individuals, and philanthropy to achieve a goal. It takes a village. It takes a orchestration, and you've been the orchestrator, and that's what your day job is now, isn't it?
Well, I think that, we recognize that you can do all this wonderful work through philanthropies, through government service. But if nobody knows about it and learns from it, we need to be able to scale that messaging. So we think about how we can work on books or films or series or using social media to educate and inform. During the Bloomberg administration, I think that one of the great challenges, it was right after 9/11. So the number one priority for the mayor, Mike Bloomberg, was to make the city safe. But he wanted to make the city healthy. And he had long been a proponent on fighting tobacco. And it wasn't until he could use the power of the pen to change laws to really influence change. And I think when he looks back, and we look back at his legacy, when he signed those no smoking laws into effect in New York City, everyone thought he was crazy. There was huge pushback. You were here. There was huge pushback from restaurants, bars. How can you tell us what to do? But, fast forward, and even today, waiters and waitresses come to him and say, "Thank you for saving my life," secondhand smoke. And the life expectancy of the average New Yorker has been extended 3 years because of the no smoking laws. And now cities, countries around the world have no smoking laws. And it was amazing to see how quickly the tide changed. The work is far from over. Now we have to fight vaping and e-cigarettes. But the message there is that, we need to stop, tobacco use to extend our lives. And so the mayor, with the help of the public health department, went out on this crusade to educate, inform, and to help people. And so I think that that's, the focus of, again, back to the series, The Invisible Shield, available on PBS, with there are 4 episodes, and we focus on, different chapters. The old playbook, Amy mentioned it, this isn't anything new. When you look back over time, history showed us that we had the playbook. We've dealt with these things before, the plague in London, the Spanish flu. It was all there. So how do we create the new playbook is where we end, with the episode 4, and how now we're inspiring a whole new generation of folks to go into the public health industry. Right after 9/11 in New York, there was an outpouring of support and newfound appreciation for police officers and firefighters. And a new generation wanted to help their city and dedicated their lives to that kind of first responder work. After the pandemic, we're seeing the same. Applications to medical schools, public health institutions are increasing, and that gives us hope. We also talk about the use of data and metrics throughout the series. And episode 2 really focuses and does a deep dive on that. And, my boss, Mike Bloomberg, says if you can't measure it, you can't manage it. So we're very data driven in everything that we've done. And, again, how do we use the technology today to make better decisions? The COVID tracker that was created by Johns Hopkins University, which Bloomberg had a hand in. Every single night we were watching on the local news, what kind of impact does this have? How do we measure it? How do we analyze where we can fight it? So the use of data is really, really important. Now with the, AI and new technologies, that's going to help us better prepare for the future, because it's not if, it's when we're going to face another one of these challenges. And it might not be COVID, but it might be another type of virus or another type of.
It could have been a lot more deadly.
Absolutely. And it was very impactful. We look at inoculation and inequity. Black and brown communities were underserved during the pandemic, and there was pushback. And, there was a disparity there. And we learned from that. And that also happened in the past. And so we need to do a better job of educating, informing, and connecting communities to address these great challenges in times of need.
Hi, I'm Jim McCann.
And I'm George Everly Jr.
During the COVID-19 epidemic, I stumbled upon an article that Dr. George wrote, which had a real strong impact on me in terms of how COVID was and was likely to impact our social connections, our relationships. And it really, really resonated with me. So I reached out to George, basically wrote him a fan letter, and that began our relationship.
We found a mutual interest in helping people become their best selves, especially in times of adversity.
Together, we embarked on a quest to co-write Lodestar. That journey began with countless hours of researching the most impactful self-help books out there.
Once we had our picks, we combined the science with the practical.
The result of our journey, the creation of a one-stop shop for the best of the best in self-help.
We decided to write this book to help others go from where they are to where they want to be and be the best possible selves they could be.
So if you're looking to boost your career, build stronger relationships, or simply become the best version of yourself, Lodestar is here to guide you on your path. Dr. Emmy, you talked about life expectancy, and you said if you were born in 1900, life expectancy was 48. I think it was 1937 when Roosevelt enacted Social Security. It had advanced by that time to 62. And now we're living to 77, 78 in this country. And that suggests that there's a lack of proper funding for the Social Security system because of the advancements in the public health. What do you think has caused this regression in the last couple of few years? Is it 100% attributable to COVID, or are there other factors?
No, there's definitely other factors. The trend, and one of the many amazing people who are in this film, like Bill Foegge's in it, who eradicated smallpox. an author named Stephen Johnson, who wrote a book called Extra Life, which is a fascinating read. Our life expectancy started, if you remember The Economist, I think it was Deacon, and I'm blanking on the name, but there was a huge economics report that actually saw that while we're making advances, our quality of life was going backwards. It is affecting people disproportionately. We've known for a long time that the more resources you have, the more likely you are to take advantage of being healthy. But we've seen this trend. We know that infant mortality, for instance, that in Ohio, my state, you're 2 to 3 times more likely to see an infant die in the first year of life if they are brown or black skinned. And why is this? And it's a complicated set of factors. It's not always a wealth related circumstance.
That's what I would have guessed.
Yeah, we actually see it. Physicians, a black physician, has a much higher risk, and why is that? And so there are issues. We talk a lot about how does race affect our lives? How does race get under our skin? There's fascinating research on the effects of living under stress and what that does to our bodies, the wear and tear of being hypervigilant.
One that's forefront in my thinking right now, Dr. Amy, is something that Catherine and the Bloomberg administration still gets criticized for. And Mayor Bloomberg became convinced that we were consuming way too much sugar. And he had tried to limit the size of soft drinks because people were walking out with these gallon-sized drinks that were, filled with sugar. And is sugar the great threat to us now from a diet and health point of view? It seems that a significant percentage of our country is overweight and in some cases obese, which is leading to higher incidence of diabetes, which is, I think, impacting life expectancy as much as anything.
Once again, we know that heart disease, diabetes, chronic diseases were certainly the leading cause of our decrease in life expectancy. I think this is important to talk about individual behavior versus a collective solution. We need all of it. I think we can't imagine driving or flying on an airplane without there being certain rules and regulations that govern our life. But at the same time, a huge part of it is what Catherine's doing here, which is educating people and teaching them better. But it's one thing to say to someone, you need to walk more, for instance, get 10,000 steps in. But if your neighborhood is not safe, if it's not easy to get outside your front door and do that, you're a little bit less likely to be able to take advantage of that great advice. So there's something called, it sounds, sciencey, but it's called the socio-ecologic model. And when we solve problems, we have to think about you. I think about you as a patient, Jim, and I think about your genetics and your family history and your behaviors. That only affects your behaviors, actually only affects about a third of your health. 2/3 of your health is impacted by things that aren't in your individual control. And so I start to look out, what institutions are you in? Are you in a school, and what happens there? Are you in a workplace? What is the environment around you? The clean air, the water you're drinking. If you're in Flint, Michigan, you know what that meant. And then you go larger to the policies we set that either make it easier for us to be healthy or the structural things that make it harder. And so we need all of it. We need our individual efforts, but we also are very much affected. And everyone, I think this is so important. All of us want to flourish and thrive. We want our families to thrive. But we have to create the conditions together that allow us to have the ability to give our gifts to the world. And we all ships rise when we create those conditions together. So it's very important to not demonize government. Government, when I think about public health workers, these were the firefighters of 9/11 rushing in. These were the people that are your neighbors and your friends and your family who every day try to improve our lives. And I think another big thing we need to recognize is that we have to build structures that are super professional with all these young people coming in, and recognize that they're doing the hard work that all of us have the privilege of taking for granted.
Prevention, I think that the idea of prevention is key here. And I think that our approach is, looking at these non-communicable diseases, NCDs, as they're referred to, heart disease, cancer, diabetes, respiratory diseases. Dr. Kelly Henning, who runs the public health team for Bloomberg Philanthropies, is always stressing that, deaths from these diseases are often preventable. And you have to work hand in glove with local communities, to get those no smoking laws in place or to make sure that seatbelts are worn. And I think that it's important to note that, shifts in societal attitudes regarding the use of these things have all been a part of the public health strategy that saves lives and improves life expectancy. So it needs to be complementary, and we need to have a vision for the public health system in this country that reflects that.
I heard just this morning something that surprised me, and I'm sure you both know this, but I've heard people say, well, why, improve life expectancy. If we're going to live to 100, look how much more we're going to spend on healthcare. And I heard this morning that the opposite is true. For people who live to 100, they actually spend 2/3 less on healthcare in the course of their life than someone who dies at 70. Because if they die at 70, it's usually because of a disease problem, and they don't usually die quick, and that ergo is expensive. But people who die at 100 usually die quick, and they haven't had those disease issues their whole life. So it's actually counterintuitive in terms of the overall impact on the medical cost systems, that to improve life expectancy is to reduce medical expense. Does that make sense?
Well, I think one of the most important things I would think about is we don't want to just live longer. We want to live well.
Healthier, yeah.
Yeah, and it is our quality of life that we're talking about. Economic development is so tied to quality of life. And one of the brilliant things I think that if we can take a pause, and this documentary does such a nice job of helping us do that, and look back, there are incredible opportunities coming out of COVID. It unmasked a lot of the issues we have. We had disease reporting systems that were so old. In my reporting system, you could not find someone to code for it. That's how old it was. And yet we came together and worked with this. But this is the time people also discovered nature during COVID. And you're seeing a lot of people really starting to prioritize time that they had with family, the ability to work flexibly, and to be healthier by being outdoors and in nature. So I see us needing to take one last pause. We have not done this. We've not had the 9/11 style commission that looks back at COVID yet, like we did in 9/11.
Might The Invisible Shield, this 4-part documentary you have on PBS, might that incite that to happen?
That's what we can hope. I mean, to get the dialogue out there, I think it's said many times in the series, and Dr. Brian Castrucci from the de Beaumont Foundation is very passionate and eloquent about saying that we need better communication. We need elected officials to be educated, to really understand this medium. Dr. Fahey reflected on when he was at the CDC, they did regular hearings on the Hill about the importance of public health and educating folks about the challenges that we face. Dr. Fahey also, talks about in the series that he speaks about the great hope he gets from his students, especially when they break down all of the silos. And he notes that students in public health have degrees in other fields, and that they have a wide view, and that really strengthens the field overall. And I think that's a constant theme throughout the 4 episodes, that the communal nature of public health and the need for individuals from a wide variety of backgrounds need to come together to work on, this powerful and essential field. It takes a village, but you need to collaborate, have different points of view, but then it needs to be channeled, and people need to be educated and informed and inspired to act and influence change.
Dr. Amy, did you work with Dr. Birx in the White House?
Our team did, and Dr. Fauci and I are he's receiving an ethics prize I'll be a part of in a little bit. But I can tell you, I saw so much heroism during the pandemic. And I think not only do we need to stop and study everything that happened and learn the right lessons from it, and so that we get it right the next time. There's also great innovation that occurred and heroism from the front line on. I mean, the stories I still hear to this day. But we have to deliberately pause, and it usually takes a while, just like 9/11. I think we have to mourn, and we have not mourned what we have lost, because we have many, many stories that need told. But then we need to make meaning out of all we endured. And I think the leaders of the future in this field, and for all of us, our job is to move forward differently. And a huge piece of that is trust, and reconnecting with one another, and intentionally pulling all these sectors back together. I saw people work together in ways. I mean, I had hospital CEOs talking to prison wardens and nursing home leaders and school teachers, and people, to see society. Actually, most people did the right thing. And we often hear about the people with, AR-15s in my yard, but my experience was overwhelming love and kindness. And I think that needs told as well.
You mentioned something earlier about the importance of relationships, the community aspects. One of the things we learned during COVID was how important they are and how they suffered during COVID. And it comes down to the little things, what a friend of Katherine and I, Adam Haft, refers to as those micro social contacts. It's the getting a cup of coffee and seeing a familiar barista who waves to you. It's saying hello to the receptionist in the office you're visiting that has a big warm smile for you. It's the fellow at the check-in desk at your office who takes the packages and who you know his name, and you stop and ask how his son did over the weekend in the baseball game. When we lost all of those little micro social contacts, we really felt the void. But you mentioned Dr. McMurtry, who's our Surgeon General, and how he's shown a light and in a very brave way on the importance of relationships. Katherine, you've been part of a big organization for 12 years. You ran the entertainment. You were the commissioner of entertainment for the city of New York. You worked at Bloomberg Media when it was you and two other people, and now as part of Bloomberg Philanthropy.
Interviewing you.
Yeah, we had bad judgment. You've gotten over that. Talk a little bit about how you shine a light on relationships in this series and their importance in terms of what you covered in The Invisible Shield.
Well, there's such a range of public health professionals that we showcase in the series that, it was just so enchanting to learn about their commitment, their work ethic, and how they work with each other. We had we focused. The first case of COVID in the United States was identified in Seattle, Washington. You'll remember it was in Milan in Italy that the first case, but in the United States, it was in Seattle. So a great portion of the series is following first responders in Seattle, Tacoma region. So we have Dr. Anthony Chen, who's dedicated his life. He is the public health. He has since retired, but running the public health department in Tacoma, Pierce County, and how during the pandemic, there was a vote to shut down, a lot of the resources in his community. And, you watch this in real time, the city council hearings, and how he and his team were, fighting and saying, we're in survival mode now. We meet Abigail Echo Hawk, who is a Native American Indian woman who is focused on protecting her community. And she tells these very thoughtful stories about when they were asking for PPE supports for masks and gloves, they were getting body bags sent to Native American Indian communities. And it was just like a disconnect between what was needed and, some social positioning. Dr. Josh Sharfstein, of course, is an incredible leader at Johns Hopkins University. And we hear from other leaders at Johns Hopkins University, including a range of students that are talking about how they've dedicated their lives and how they're optimistic about the future. And then seeing Amy, I mean, the sequences of what Amy went through in Ohio and the protests at that time and the vigilance and the dedication and professionalism was just outstanding. And I think that, just seeing this and being inspired by this passion to serve, this passion to inform, this passion to help. I mean, that's what what doctors do. But here in unprecedented times, to see these people really tested, but how they prevailed and how they continue to prevail. And maybe now, they're not in their roles like Dr. Amy Acton, and she's going to be thinking about how she can use her skill set to better serve her community in a variety of ways now. It comes down to they all have great stories. We were channeling and gave them a platform to tell their stories, which I think audiences will be intrigued by and inspired by. And so I think that's, our purpose in discovering these people and taking the facts and a challenge that we face and finding a creative way to educate people about how these people are making a difference each and every day.
Whose idea was this?
Mike Bloomberg. As I said, we were at home, sheltering in place. I'm listening to Dr. Josh Sharfstein, Public Health Saved Your Life Today, and you didn't know it. And the light bulb went off, and I basically messaged Mike and I said, people don't understand what public health is. And, during the pandemic, we were all on an even playing field. Everyone was waiting online for those vaccinations. Everyone was, wondering what was it wasn't if you had a connection at a hospital or whatever. No, that didn't exist. Everybody was in the same boat, and we were desperate for information. And it was really helping to find that sense of community to get through this. And so I think that I said to him, this is a way that we could help educate, inform now and forever. And the wonderful thing is, since the release of this series, we have public health departments and universities around the country asking us to host screenings, host panels. Amy is going to be participating in some of the up and coming panel discussions we have. The public health community has never had this kind of reflection on their work. And so, yes, it's a series that aired, but how do we, get more out of it? And how do we, we have lesson plans, we have a viewing guide so that people can host their own screenings on a campus or in a public health department in a local marketplace. And then from time to time, we can bring in the experts, some of the stars of the series like Dr. Amy Acton, to bring it to life and have a very thoughtful conversation and contemporize where we are now. And we are in an election year, and public health.
This is an election year? I hadn't noticed.
So we can't forget about our public health policies and the needs at a, state, federal, and local level.
Dr. Amy, what has surprised you about the reaction you've gotten so far?
I think a lot of us just don't realize what all around us is affecting our health. And so this series starts with the Black Plague.
Good, a cheery start.
Cheery stuff. But you recognize all of a sudden the similarities and the ingenuity of people.
And the timeline.
And a timeline. And
it's the same number of years.
It is the travesty of how we are as humans, that what we don't see. When I became a doctor, nobody could recognize the measles rash anymore except the old timers, because we had effectively eliminated measles from our country. And as we know, we have outbreaks again. So this is that 2-step forward, 1 step back, where we have the privilege of not worrying. I didn't worry that my kids were going to go to the playground and might end up on an iron lung. But now we can easily forget all we have gained. So this is a time for us to sort of understand our place in this overlying arc and sort of double down on what truthfully we all hold dear. And you don't ever get everyone all of the time. My feeling is if you just get enough of us to do the right thing most of the time, we all end up getting through. And honestly, that actually did happen during the pandemic. And I just love that we get a chance to meet some of the people who gave their lives hour after hour, day after day. And the kindnesses, like you said, Jim, the random acts of watching a nurse's child while she did the double shift, or the elderly person putting some groceries out because they couldn't get to the store. There were thousands and millions of stories like that. And maybe this is the beginning of telling them.
Katherine, as we get toward the end of the calendar year and we convince you to put on your calendar to get together for a nice dinner someplace, we get you to sip a glass of really good wine, and I ask you,
From Harry and David.
well, that could be, and I ask you, what did you want to get from this, and what do you think you've achieved in the early months of its release and its impact?
Well, I think we've gotten some really strong critical acclaim. The reviews have been very positive, but more than that, it's the public health departments around the country that are so grateful that we shed a light on the work that they do. You know, the invisible shield, a lot of these people are invisible, and we brought them to light, and we put the spotlight on Dr. Amy Acton in a way that, you know, we never would have imagined. And I think that it serves as, these are role models. One of the reviews of this series talked about the superpowers of public health experts, and there are superheroes. And I think that that's true. You know, Amy has wings and a cape behind her, and you know, and the enchanting thing is to see so many women. You know, aside from Dr. Amy Acton, we had Dr. Kelly Henning, who runs, you know, the public health department at Bloomberg Philanthropies and served as in the public health departments in New York. Dr. Mary Bassett, who's now at Harvard, who is both the public health commissioner in New York City and New York State. Abigail Echo Hawk leading the charge for Native American Indians, and countless others. You know, I'm not, we don't have the time now for me to run down the list, but these are amazing, amazing women who are educated and motivated and thoughtful and real doers. And it's just inspirational to a new generation, and also to somebody like me who just sits on the sidelines in awe of these folks. And thank God for them. And so I think in a small way, if we can elevate what the good work that they're doing and help a next generation to protect all of us, that's a really good feeling.
Well, that's what I'm intrigued by, but not at all surprised by with you. You have a cape under your shirt too. I know that. I've seen it firsthand. And the cape comes out here when you've already talked about how do you take this series and institutionalize a message from it. And you've already hinted at how you're doing that with working with the public health departments, putting on workshops and programs, institutionalizing the effort. So this is the tip of the iceberg, I suspect, in terms of what this could become. And it just shines such an important light on the benefit we have in our country, our culture, our society, that we have government, that we have philanthropy, that we have individuals, we have capitalism. They all come together. It takes lassoing, and that's exactly what you're doing here. And it takes fuse lighting, and that's what you're doing here. I so applaud the work you've done here. Katherine, I'm a fan of yours forever. Dr. Amy, so nice to meet you. And if you're thought of highly by Katherine Oliver, you're in awfully good company. Congratulations on this project. What do people do if they haven't seen it? How do they get to see it? And if they have seen it, how can they see it again?
So you can go on the PBS app, which is free, and the Invisible Shield, and you can access it that way. You can also go to the website and the Invisible Shield and
theinvisibleshield.org. Yep.
And you can download the viewing guide and learn about each of the episodes, the overall project.
Congratulations. Thanks for sharing your message with us. And we all look excitedly to see how this becomes a real effort that just began with your saying, hey, let's go make a difference.
Thank you both. Thank you.
We put our heart into everything we do. We are farmers, bakers, florists, and makers who grow and create with a passion. Made with love at every step of the way. Because at the end of the day, we know you're sending more than a gift. 1-800-Flowers, share with love.
Well, I hope you enjoyed what you heard, and I know I'll be sharing it forward. I hope you get to as well. Let's keep the conversation going. Follow me along on Twitter at Jim 1-800-Flowers and on LinkedIn at Jim McCann. Hope to talk to you soon.